Good evening, viewer. Welcome to our Glory Globe TV. Here's most breaking news. A deadly outbreak of pistachosis, a bacterial infection also known as parrot fever, has affected people living in several European countries, the World Health Organization said on Tuesday. Outbreak was initially noted in 2023 and has continued through the start of this year. The deaths of 5 people have been also reported. Parrot fever is caused by bacteria in the Chlamydia family that is found in a variety of wild and pet birds and poultry. Infected birds don't always seem sick, but they shed the bacteria when they breathe or pop. Humans commonly catch parrot fever by breathing in the dust from an infected bird's secretions, according to the US Centers for Disease Control and Prevention. People can also get sick if a bird bites them or through beak to mouth contact. The disease is not spread through eating infected animals. Human to human transmission is possible but rare. Studies show, in most of the recent cases, people had been exposed to domesticated or wild birds that were infected, who said. Most people who get parrot fever have a mild illness that begins 5 to 14 days after exposure to a sick bird. It can include a headache, muscle pain, a dry cough, fever and chills. Antibiotics can treat the infections and it is rarely fatal for humans. Austria, which typically sees 2 cases of these diseases each year, reported 14 confirmed cases in 2023 and 4 more this year. As of March 4, the cases are unrelated and none of the individuals reported traveling abroad or coming into contact with wild birds. Denmark typically sees 15 to 30 human cases every year, most stemming from exposure to pet birds or hobby birds like racing pigeons. It has 23rd confirmed cases with this outbreak as of February 27, but public health officials were suspect that the case count is actually much higher, who said. Of those Danish cases, 17 people have been hospitalized, 15 had pneumonia and 4 have died. At least one person in Denmark got parrot fever from a pet bird. Of the 15 other cases with available exposure information, 12 said they had contact with wild birds primarily through bird feeders. In 3 of the cases, the patients had no history of contact with birds of any kind. Bend the report, Glory Globe TV, Delhi, Bharat.